Hey everybody, my name's Dr. Trey. I'm a physical therapist and a trans man, and I had a great question asked to me about my phalloplasty procedure and what the electrolysis looked like leading into it. Now, for those of you who don't know, electrolysis is the process of permanent hair removal that you need to do from the donor site prior to phalloplasty. So I had what's called RFF, or radial forearm phalloplasty, where they take the skin graft from my forearm. So prior to the formation of the urethra, especially, and the shaft, we need hair removal. So what I had to do is go into an electrolysis professional for about a year and a half before the surgery. And I don't know if you can see on this arm, I'll throw some pictures up as well. I'm pretty hairy. So it took me going in anywhere from 1 to 3 times a week for a half hour to an hour and a half at a time for my sessions. I would say most often I was going once a week for an hour. It cost me about $100 a session to get this hair removal. Now, electrolysis is not perfect. And what I mean by that is when they remove a hair follicle, hair grows in different stages. So there's 3 stages of hair growth. And if the follicle is in stage 1 or stage 2 of growth, when they zap it with the little laser and then pluck it out, it's dead. It's not going to regrow. However, if the follicle is nearing stage 3, it will regrow because it's already near the end of its life cycle. Now, you can't look at a hair and be like, that's a stage 3. So I would say roughly a third of the area that they do the electrolysis on grows back every time. So then you have to keep going back, which is why you need so long before your surgery to get it done, depending on how hairy you are. Now, I also have very fair skin and blonde hair. So laser did not work for me. Some folks will be able to get laser done first to get the majority of the hair gone. I went in for 2 laser sessions and they were like, look, you're not a candidate for laser. Like, this is doing absolutely nothing, because there has to be a contrast in color. So it works better with very light skin and very dark hair, which my arm did not have. So I had to do all electrolysis. Now, according to my insurance manual, because I live in Washington State, trans care is mandatory in Washington State, thankfully. And it's said in my insurance manual that they cover electrolysis for surgical procedures only, not for just cosmetic, which is dumb because trans care is not cosmetic. Whole other story. Anyways, they said they covered it. I had a letter from Dr. Chen, my phalloplasty surgeon, saying that hair removal was necessary in order to do this surgery, preventing infection, especially in the urethra, blah, blah, blah. And I sent it in, and I appealed it like a bajillion times. And I think in end, they reimbursed me like $1,000 out of the $12,000 that I spent on electrolysis. So insurance is a racket in this country. We all know that. But anyways, it technically is covered by insurance in Washington State. It didn't end up really being covered, so I had to pay out of pocket for it. The sessions are not super painful on your arm. However, they are pretty painful down below. So what I mean by that is, because not all of my hair was removed perfectly prior to surgery, some continue to grow back after the surgery. And I had electrolysis once every few months, probably 10 to 12 sessions post-op, down below. And that really sucked, I'm not gonna lie. So if you can, do electrolysis as early as possible, get it as clean as possible so that afterwards you don't have to do what I did and have post-op electrolysis. The electrolysis is around a half to 2/3 up your arm. My line stops about here, and it starts at the wrist, and then they don't take all the way around. So I have a little section on my pinky side that's not taken. So they take most of this. So I would say when you start sitting down for electrolysis, say start at the wrist and come up and focus here first, and focus on not fully the ulnar, not fully the pinky side, but just a titch inside of that, because that's where they take the urethra from. So that's the most important, that you have perfectly clean. The shaft, obviously, that's a personal preference. However, you can get it done afterwards if you need it. I hope this helps. And if you have any other questions about my phalloplasty procedure or anything else I do as a physical therapist and trans man, please shoot me a comment and I'd be happy to make a follow-up.